I'd love to introduce Nicole Friday, and thank you for being here, Nicole. You're in hospital administration. The
Yes.
hospitals, yes. And you have all the hospitals from the beginning have been, and now again, have been in the media for not having enough medical supplies, not having enough beds. I want you to please tell us all about what you've experienced in the hospital. And so first, let's just say, so Nicole, what do you actually do for hospitals? What is hospital administration? I'd love to know.
That's an excellent place to start. And I'm going to keep my segment very brief. I've learned very early in my career, when you have a world-renowned cardiologist that's going to follow you, you're going to keep your segment brief as a healthcare administrator. So healthcare,
I love it.
Yes, we work in partnership with physicians. That's first and foremost. But what we're tasked with doing is really keeping the business of healthcare running, right? So we're focused on our people, because if you think about it, a hospital without people is just a building with a bunch of beds, right? So we're focused on our nursing staffing. We're focused on making sure we have the right number of pharmacists. We're making sure that when our physician comes in to treat a patient, that they have essentially everything that they need, right? So people is key. Then we're focused on patient satisfaction. We want to make sure that everyone has a great experience when they come into our doors. And that's whether or not we're facing COVID, or if it's a pre-COVID or post-COVID world, which we will hopefully will get to at some point. Quality is key. We're always looking at quality in our outcomes, because we have to ensure that when patients are coming to us, either in the hospital setting or in the outpatient setting, that they're receiving quality care. That's tantamount to who we are as an organization, and what we do is we have to make sure that when you're coming to us for care, that you're actually getting better. So we're tracking quality measures, we're reporting out on our quality measures, and we're continuously trying to improve on our quality. Growth is another thing. We have to ensure that we're growing in various areas, so that if we have a great interventional cardiologist program, that we're marketing and we're communicating what's going on, so that people are coming. And for Mount Sinai, you have people who are coming from all across the world for the level of expertise that they have there. I've worked in an organization in Memphis, Tennessee, which was U.S. News and World Report ranked in 8 different specialties, and we could draw people from across the world for some of our highest level specialties, right? And you want to think Memphis, Tennessee, everyone in Memphis knows that we have St. Jude, but St. Jude is a small hospital in terms of number of beds. So they do pediatric cancer surgery, and what we did was everything else. We did everything else, and we actually did their surgery, some of their surgeries at our hospital. And then we're looking at finance, right? Because one key thing that you're going to learn in any industry is no margin, no mission, right? So we have to ensure that at the end of the day, we have enough money to put back into the organization to really ensure that we're able to provide quality care to every individual. And we're looking at our efficiency. We're making sure that we are being good stewards of the resources, right? So we have enough supplies. We're ordering supplies on a timely basis.
The PPE, right? The PPE supplies that we've been.
Yes. So that's the job of a hospital administrator, really to focus on our key performance indicators and make sure that we're moving the needle on those items. So our world as hospital administrators, just with physicians, also got upturned with COVID, right? So with COVID, we're now facing a pandemic. A pandemic isn't something that happens every day. So we are, right.
Now it is.
You know, the last pandemic we faced of this scale was back in 1918. So this hopefully will be our one time in which we face a pandemic in our lifetimes, but it could happen more, you know, based on what's going on in the world. So really we had to be agile, flexible, and able to respond to the information that was coming out from public health and from the CDC, which at the beginning of the pandemic was changing on a daily basis. So it's the role of the healthcare administrator to really work in tandem with our physician partners and aggregate all of this data that's coming in, all these recommendations from what face covering should be, what PPE should be at different levels of service, and then push that out. And then we had to respond very quickly and come up with recommendations on what does it look like when you're coming into a hospital setting. That has changed drastically. If anyone has been into a hospital, you know now that across the board, we have limited the number of visitors that can come into our healthcare space.
Yeah, that's what I want to jump into. Okay, yeah. So where were you in March during where were you?
At the beginning of March, I was still at Le Bonheur Children's Hospital, which is a phenomenal children's hospital in Memphis, Tennessee, and this outbreak was happening. And we didn't really know in the beginning. We knew that there were going to be hotspots, right? Because in a pandemic, it's really population driven. So New York, LA, most populous cities are going to be where you're going to see the effects of a pandemic first. In Memphis, Tennessee, we are not a huge city, but we knew that eventually would be coming. So there was what we would see in New York, and we didn't know at the time how bad it would get throughout the rest of the world, right? Because the world is not new to pandemics. Pandemics has happened over time, and public health is very aware of how you actually treat, track, trace, and eliminate pandemics. So we didn't know if this full scope of, or the full brunt of the pandemic was going to come to Memphis, Tennessee. But regardless, you still have to plan, because in America, people can travel. So even though, Memphis, Tennessee isn't the most poppin' place, we're not Nashville and we're not Atlanta, but we're still on the map, and people can fly into Memphis, and we're actually the #1 hub for shipments out of Memphis, Tennessee, because that's where FedEx is located. So.
Oh, really? That's interesting. Okay, so what happened emotionally? Like, what were you feeling about this? I mean, your role was to be a hotel administrator, right? So, you just like had this like black swan happen, in a sense that you're like, okay, what are we gonna do? And tell me about, like, how was the collaboration happening? You said that you manage or make sure that the doctors have all their equipment. Tell me a little bit more about what you were feeling during this, if you don't mind sharing.
So we very quickly went into kind of a war room situation, right? Where we had people from every aspect of the hospital. And then a lot of people, when you think of a hospital or you think of healthcare, you think of doctors and nurses. And that is very true. There are a lot of doctors, there are a lot of nurses, but we also have pharmacists. We also have x-ray techs. We also have food service. We have EVS. And we had to come up with a comprehensive plan for everyone, right? And so we brought everyone together. We had daily phone calls. We were meeting in our command center, going over what are we going to do? How are we going to respond? What is necessary in terms of resources? And what are we going to do to ensure that everyone stays safe? And as a healthcare administrator, you're concerned not only about the safety of the community, but the safety of the people in your organization. That's key. So this conversation that's been happening around personal protective equipment is very, very big and near and dear to the hearts of every healthcare administrator, because if we don't have people in the hospital, again, it's just a big building with a lot of beds. So we had to ensure that our people are safe.
All right. So you've been there since, are you still where you were in the beginning of COVID, and are you experiencing this again?
So actually, I had accepted a new role. I had, in the midst of, prior to COVID, I didn't know COVID was going to happen. Unfortunately, I don't have a magic ball and couldn't see this coming. So I actually moved.
Bill Gates did. Anyway, yeah.
I moved across country in the midst of a pandemic and started a new role with a very different healthcare organization. And that was a crazy, crazy experience. First of all, I wouldn't recommend it to anyone. If you know that a pandemic is coming, if you have insider knowledge, you probably should stay put. But I did not have this insider knowledge, and it was a great career opportunity, so I thought. So I was moving up in my levels of leadership and taking on more responsibility in an organization that is nationally known. And so I moved across country, and the pandemic, believe it or not, was there too. Pandemic means worldwide. So then it became, again, we're fighting this pandemic day in, day out. The good news is we were a little bit further along, so it wasn't a thing of how do we get enough PPE. It was more, okay.
Right. So wait, okay. And then what happened?
So in the midst of that, what I would say about COVID is it is novel in that we haven't seen this COVID-19 before, but what it does, it's really a magnifier of what's going on already in a healthcare organization. So I would say that COVID does not make an organization, it shows an organization's true colors. And so the organization—
So I've always said it's like a magnifier of like the problems that we were facing in COVID. So what did you learn?
And so what I learned when I went into this new organization, that it really didn't align with my core values, right? The way in which they treated their physicians didn't align with how I wanted to treat physicians, the quality of care. And so I chose to furlough myself. I'm unique in that sense. But what I will say is
did you just say you furloughed yourself?
Yes, it's a unique way of saying I resigned.
Why?
And honestly, it just wasn't an organization that aligned with my core values. I mean, a lot of what you can see in healthcare, they're very different organizations. We do not have a universal healthcare system. So we have for-profit systems, we have not-for-profit, we have faith-based, we have a number of different systems. And then in these different systems, your approach to healthcare is different, right? You might have different values and different things that you are searching for, doing in different kind of ethical guidelines. So the organization that I walked into did not meet my own personal core values in terms of delivery of healthcare. So at the time, it was coming down to a choice in which we were going to have to lay off a number of staff. So I, in turn, chose to resign because I knew that this was an organization that I could devote my full self in the midst of the coronavirus to.
So you told me you're a consultant right now with the life's work of committed to eliminating healthcare disparities. What does that mean?
So I think we should back up at this point and talk a little bit about the difference between healthcare.
Fortunately, we only have a couple minutes, so we got to be quick. Sorry, I know it's a big subject.
We'll get to this quick. So the difference between healthcare, which is the delivery of the organized delivery of medical care, and health, is that health really focuses more on the state of complete physical and mental and social well-being, and not just the absence of disease, right? And so in America, we spend a lot of money on healthcare. We beat every record. We spend more than any other country on healthcare. But yet our health outcomes are not as great as other developed nations and some underdeveloped nations. And what's really driving this are social determinants of health, right? And the social determinants of health are the conditions in which people are born, grow, live, work, and this is something like your socioeconomic status, your education, and your physical environment. And we see disparities in health outcomes based on these social determinants of health. So the work that I do and what I'm passionate about is eliminating healthcare disparities. Okay, does that make sense?
Yeah, wow. Okay, well, I hope we see you continue your goals. Again, I've always said that COVID is a magnifier of all the shit that plagued our society, and hopefully an accelerator to the world that we want to have. And there's people like you, Nicole, who really are there to try to make the world a better place. And we will always support you. So please put your information in the chat. And thank you so much for your time and good luck. And, this is a tough time. And thank you for, helping us all try to get through this on a health level, mental health level, and in terms of racial and class disparity. So thanks so much. All right.